hello there. Please come on in, take a seat and make yourself comfortable. Just confirm your date of birth for me. Wonderful, thank you. Okay, so what brings you in today? Okay. And just tell me a little bit about what you've been experiencing. Okay. Is it painful? Okay. And when did it start? Okay. Have you tried anything to relieve it? Okay. And would you say you've got a fever or a cold or anything at the moment? Okay. And are you up to date with all of your vaccines? Okay. And have you been experiencing any blurred vision, double vision, any watering in the eyes, any discharge of any kind? Okay. And how's your sense of taste and smell? Okay. Lovely. Have you been getting any ear pain? Any tenderness around here? Okay. And regarding your muscles, any tension, spasms? Okay. Lovely. Okay. Well, do just relax back where you are. Okay. I'm just going to put some gloves on and then I will just give you a bit of an examination, okay? Alright. Got my pink gloves. I much prefer the pink gloves, adds a little bit of colour. Yeah. Okay. Okay. So I'm just going to come a little bit closer, okay? I'm just going to have a little feel around of your face and your body, okay? Just to make sure there's no tension or anything. Do let me know if you have any pain or discomfort, okay? Any pain or discomfort? Okay. What about on the top of your head? Any pain or discomfort? Alright. Okay, I'm just going to feel your face. Can you hear the birds? This feels fine. Any pain or discomfort? Okay. Okay, your head's generally fine. Would you be able to just move your head for me from side to side? Does it really stretch? Good. Side to side. Side to side. Okay. And now can you do it up and down? Good. Any pain or discomfort? Wonderful. Okay, so I'm just going to feel your shoulders. Okay, and then your arms. Okay, and just the rest of your body. Just let me know if you have any pain or discomfort. Okay. Shoulders are fine. Can you just lift your shoulders up and down, up and down? Good. Can you rotate your shoulders? Good. Okay, I'm just going to feel your arm. Again, do let me know if you have any pain or discomfort. Generally feels okay. On the other side. Okay. That feels good. Alright. Can you just do this for me? Good. Can you do this? Can you do this? Can you do this? Very good. Okay, I'm just going to feel your chest, put a bit of pressure on, and I'm just going to push your tummy, okay? Again, let me know if you have any pain or discomfort. Good. Good. Okay, I'm just going to push your tummy. Good. I'm going to put that pressure on. Good. Okay. That all feels fine. Okay, everything is looking really good at the moment. Yes. I'm just going to listen to your chest. Please do just breathe normally for me, okay? Okay, just gonna pop this one here. Good, just breathe normally. Good. And the other side. Good. And just here. Perfect. Now if you can, just take a nice deep breath in and out. Take a nice deep breath in and out. Good. Okay, I'm gonna have another listen. Okay, I'm just gonna pop that there. Breathe normally. Good. Okay, now take a nice deep breath in. Good. Take a nice deep breath in. Very good. Just do a cough. Good. Breathe normally. Good. Okay, that all sounds absolutely fine. I'm not concerned at all. Doesn't sound congested or anything. Okay. Now what I am going to do, I want you just to read this chart for me, okay? Just the numbers that you see here. So what number is this? 9. Good. And what's this number? 5. Good. What's this one? 8. And this one? 7. Good. And how about this one? 4. Good. What about this one? 2. This one? 8. This one? 4. 3. Well done, that was really good. Okay. What I'm going to do, I'm just going to have a little look into your eyes. I just want to make sure they're okay. So I've got a light here. Okay. Now just look straight at me or over here. Do not look at the light, okay? Do not look at the light. Do not look at the light. Look at my hand. Okay, just blink, blink, blink. Okay, look over here. Again, do not look at the light. Do not look at the light. Look straight at me. Good, look straight. Good. Keep looking straight at me. Just look straight. Do not look at the light. Look straight at me. Do not look at the light. Look over here. Look at my hand. Okay, look over here. Look at my hand. Do not look at the light. Okay, now you can blink, blink, blink. Alright, just look up for me. Look up. Okay, look down. Look that way. Look the other way. Okay, good. Look up. Look that way. Look the other way. And look down. Okay, look up. Look left. Look right. Look down. Good. Okay, look up. Look left. Look down. Look right. Good. You can blink. 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 Okay, look at the light. 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 Okay, I want you to now follow the light. Follow the light for me. Follow the light. Good, blink, blink. Gonna try it on this one now. Okay, look at the light. 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 Okay, now follow the light. Very good. You can blink, blink for me. I want you just to look here, look here, look here, look here, look here, look here, look here. How many fingers am I holding up? How many? How many? How many fingers am I holding up? How many? How many? How many? How many? How many? How many? Very good. Okay, follow my finger. Follow my finger. Okay, follow this finger. Good. Tell me when you can see my fingers. Good. 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 Very good. Now tell me when you can't see them. Good. 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 Very good. You can blink, blink, blink. You're doing really well. I'm just going to use this, and I want you to tell me if you can hear the sounds in both of your ears, okay? be very gentle, do not worry. Okay, but it's just like a ringing sound. Okay, ready? Did you hear that? Try again. Did you hear that? Perfect, and this side. Did you hear that? Okay, again. Did you hear that? Lovely. Now tell me if you can hear this. Did you hear that? Perfect. Now, I'm just going to test. I'm going to make some sounds behind each ear. I want you to tell me which side you can hear it, left or right. Ready? Which side? Good. 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 Very good. Okay, you did really well there. I don't think the issues with your hearing or your ears at all. Okay, I think you could do with a blood test. Yes, and perhaps a full eye check with different lenses and things. I think your headaches might be because you might need some glasses, or you might need just a change in prescription, or alternatively, you might just need a deeper look into that. I think that's the issue. Okay, I am going to check a couple more things. I just want to check that you haven't got a temperature, so just look straight at me. Good, now your temperature is absolutely fine. And finally, what I'd like you to do, I want you to just sniff a little bit of this for me and just tell me what you can smell. Okay. What does that smell like to you? Good, well done. Now I want you to taste this bit, okay? So I want you just to stick your tongue out. And just, what does that taste like to you? Very good. Well done. Well, I think everything is actually fine. Okay. I'm just going to take these gloves off. What I think for you, you just need some rest, keep yourself hydrated, and I'm going to book you for a thorough eye check and a blood test. Okay? So I'm just going to make note of that. You're for a blood test. That will be next week. And an eye test. Perfect. Well, that's you all done. Please do not worry. Take it easy, rest, and keep yourself well hydrated, okay? You're more than welcome. Take care. It was lovely seeing you. Bye-bye. Oh, hello there. My name is Bryoni. Now, I've just come to check your observations, your vital signs. Is that okay? So it will just be your blood pressure, your oxygen saturation level, your heart rate, your respiratory rate, your temperature, and I will also just have a little listen just of your chest. Is that alright? Lovely. Okay. Well, do just make yourself comfortable. Okay. Now, I'm just going to check your temperature. So I'm just going to use this. And it's just going to go just here on your forehead. Okay. Alright, you ready? Perfect. It's 36.7. Your temperature is fine. Now I've got here, this is an oximeter. You just pop your finger in there and it just tells me your oxygen saturation level and your heart rate. Okay, so just pop your finger in there for me. That's it. Pop it in and just hold it. Just hold your hand out flat. Lovely. And now just take a nice deep breath in and out. Take a nice deep breath in and out. Oh wow, it's 100%. Well done. Now it also says that your heart rate is about 86. I will check that manually, don't worry. I'm just going to take that one off. So I'm just going to check your heart rate. I'm just going to feel for your pulse, okay? Just pass me your wrist. That's it. I'm just going to check it for a minute, okay? Okay, that's interesting. I actually got 86 as well. That's so strange. So it means it's working, but your pulse is regular. I didn't feel anything sort of irregular with that. I didn't feel any sort of ectopics or anything. Okay, alright. So I'm now just going to check your blood pressure. Okay, have you had this taken before? Right, okay, so the cuff goes on your arm. Okay, I will feel for your pulse. Okay, I will pump the cuff up until I can no longer feel your pulse. Okay, and then I will deflate it. Okay, I will then inflate the cuff again so I know how much to do it, and then I will listen for when the sound comes in for your blood pressure, and then when it goes up, that'll be your bottom number. Okay? Alright. So, just going to, first of all, just want to feel up here just for your artery. Is that okay? Just gonna push. It's usually under that muscle. There it is. Okay, so I'm just gonna put this on. If you can, just slide your arm in there for me. That's it. Put that right up. I'm just going to tighten it. Lovely. Now just relax your arm there. Okay. What I'm going to do, so it's a bit fiddly. I've got to hold these two, okay? Just gonna make sure this is closed. Lovely. Okay. So I'm just going to feel your wrist and I'm just gonna pump this up, okay? Till I can't feel it anymore. About there. Oh, sorry, it's a bit tight. I'm just going to deflate that. That should be deflating now. Lovely. Okay. Alright. What I'm going to do now, I will pump the cuff up, but this time I'm just going to have a little listen and check your blood pressure. I'm just going to pop this just under there, just under the cuff. Lovely. Okay. And I'm just going to pump it up, alright? Lovely. I'm just going to listen. Okay. There it is. Okay. Lovely. Your blood pressure is 126 over 77. Okay. I'm just going to take this one off you. So just slide your arm out for me. Just take that little bit of air out. Lovely. Okay. Now what I'm going to do, I'm just going to assess your breathing. So I want you just to breathe nice, natural, and normal. Okay. I'm just going to see what your respiratory rate is, okay? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Good. Your respiratory rate is 16. That's absolutely fine. Now just breathe normally as you were, okay? I'm just going to have a little listen just to your chest. Okay. Lovely. And here. And now here. Okay, take a deep breath in. Good, breathe normally. Okay, deep breath in. And out. Wonderful. Well, your observations are absolutely fine. You're doing really, really well. Okay. Now I hope you continue to feel well. But if you do have any problems, please do come back to see me. Okay? Alright. Well, do take care. And you know where I am if you need me. Bye-bye. Okay, so next we should have... Oh, hello there. What's your name? Oh yes, you're right on time. My name is Bryoni. Please take a seat, make yourself comfortable. Now, before I begin, I need you just to confirm your date of birth for me. Lovely. Thank you. So, just tell me what brings you in today. Okay. Alright. And what sort of symptoms have you been experiencing? Okay. Yeah. Okay, no problem. I will do a thorough check. So, have you been experiencing sort of anything regarding your vision where it might be off? So, any blurred vision, double vision? Okay, any times where your vision has changed? Sort of sporadically in the moment, where it's been fine and then just changed? Okay, have you had any dizzy spells? Okay. Any loss of consciousness at all? No, that's a good thing. And regarding your eyes, have you had any discomfort, say, watering, redness, anything at all? Okay. Any gunk or anything, discharge? Okay. Lovely, thank you. Now, have you experienced anything like this before, previously, any time? Okay. Does this run in the family? Do you know anybody else who experienced the same sort of thing? Okay. Alright. Okay. And now to your medical history. Do you or anybody in your family have diabetes? High blood pressure? Okay. Any sort of cardiovascular disease? Okay. Any thyroid disease? Okay. Any other diseases or anything I should be aware of? Are you diagnosed with anything? Okay. Alright. And now for your lifestyle. So, what do you do on a sort of a day-to-day? Do you work, study? Are you at home? Do you watch lots of TV? Are you in front of your phone or a computer? How do you spend sort of majority of your time? Of course, screens can affect the eyes, yes. Okay. Alright. Well, it doesn't sound like anything too serious, so that's reassuring. I'm now going to begin your main exam, if that's okay. Alright. Please do just make yourself as comfortable as you can. Okay. Alright. Okay. I'm just going to get some gloves. I've got pink gloves. I thought I would add a bit of colour. So what I'm going to do, I'm just going to have a feel around of your eyes. Okay. Just first of all. Alright. Do let me know if you have any pain or discomfort, okay? That's really important. Good, you're doing really well. Okay. I am going to clean your eyes for you, okay? There's a little bit of gunk in there. I think that might be the reason why your eyes are a bit itchy. You might have a little bit of an infection, okay? Only a tiny, small amount, just right in the corner there. So what I'm going to do, I'm actually going to just clean your eyes. And then I'll pop some drops in. Okay, and that should relieve that for you. Like I say, it doesn't look too bad. I will probably prescribe you some wipes and some eye drops, okay? So I'm just going to clean both of your eyes. Shouldn't hurt. Hopefully it's quite gentle. The other side. Just gonna dab. Lovely. Now I am going to pop in some eye drops, okay? It just looks like this. It's just saline. And it's just an eye wash, okay? I'm going to prescribe you some of these and some wipes so you can clean your eyes yourself. I suggest you try it for a couple of weeks. If there's no improvement or it gets worse, do come back, okay? So I'm just going to pop some of this on. So you just break the cap, like so. And then I'm just going to, okay, ready? Just gonna drop. Okay, and the other side. Are you ready? Close your eye. That's it. Just blink for me. Is that one dripping? There you go. They do drip a bit, yes. Okay, the other side. Ready? Okay, just close your eyes and blink a little bit. You're doing really well. Just gonna tap, 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 tap. They will drip for a little bit, but as long as they're in there, that's gonna really work, okay? Alright. I'll let you just sit there for a moment just while that settles in. You can just close your eyes, close your eyes, close your eyes. Let that just sink in, okay? How is that? Good. Okay. Well, I do think that will resolve your issue. Yes, you got a little bit of gunk, but we managed to get most of it. Just keep wiping them every day. Put the drops in. Twice a day should be fine, morning and night. Okay, and that should relieve that for you. Okay, keep yourself hydrated as well. Yes, I will prescribe you that so you can get that afterwards. Okay, lovely. Now, just while you're here, I am just going to do a few more different checks just to make sure your eyes are okay. All right. So just look it, look it, look it, look it. Look it, look it, look it. Good. Look at my finger. 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 Good. Can you follow my finger? Follow my finger. Good. Really follow this finger. Good. Just blink, blink, blink. How many fingers am I holding up? Good. How many? How many fingers? How many? How many? How many fingers? How many? How many? Good. Look straight at me. Straight ahead. Good. Okay. I'm going to reel my fingers. Tell me which side moves, but you can't look. You just got to look straight. Okay? Focus. Good. 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 Very good. Okay. Just blink. 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 Well done. I'm now going to use a light. I'm going to look into your eyes, okay? I don't want you to look at it. You can look over here in this direction. Look over here. Do not look at the light. Do not look at the light. Do not look at the light. Look over here. Look over here. Okay. Now look this side. Do not look at the light. Look at my hand. Do not look at the light. Look at my hand. Okay, just look up for me. Look up. Okay, look down. Okay, look left. Look right. Okay, look left. Look right. Okay, look up. And look down. Okay, look up. Look left. Look down. And look right. Okay, look up. Look down. Look left. And look right. Very good. Look over here. Look up. Look down. Look left. Look right. Okay, look up. Look down. Look left. and blink, blink, blink. You're doing really well. Look at the light. I want you to follow the light. Just follow the light. Follow the light. Follow the light. Very good. Good, you're really, really good at that. Just blink, blink. I'm gonna try just brighter. Okay, look at the light. Good, now just follow the light. Follow the light. Follow the light. Keep following the light. Follow the light. Follow the light. Well done. You can blink, blink, blink. That's it, just blink. The light can be quite bright. Well, your eyes generally look okay. You have a little bit of gunk there. Just to avoid an infection, I will prescribe you some wipes and eye drops. You need to take them twice a day, put them in each eye, and try that for about 2 weeks. Okay, and if it gets worse, do come back, but if it's sort of the same and then gets better, you're absolutely fine. Okay, but do come back if you get worried. Alright? Problem, I think it will clear up on its own. Okay? That's okay. Thank you so much for coming to see me. You're most welcome. Take care. Bye bye. Bye bye. Bye bye. Oh, hello there. Please do come on in. Make yourself comfortable. My name is Bryoni. What's your name? Ah yes, perfect. You're right on time. Could you just confirm your date of birth for me? Wonderful. Okay, now what brings you in today? Have you been experiencing anything unusual, anything out of the ordinary? Any particular symptoms? Okay. Any blurred vision, double vision? Any pain at all around your face, your shoulders? Okay. Is this more of a general checkup? Wonderful. I've seen just here you've managed to maybe cut yourself. Yeah, you've got a little scratch. Would you like a plaster? Okay, I've got one. I've just got a wipe here. I'm just going to give it a little clean and then I'll put the plaster on for you, okay? You may have just scratched it, that's all. It's going to be a bit cold and it might sting ever so slightly, okay? don't get an infection. Lovely. Just let that dry. Perfect. And then I just got a plaster here to pop on, okay? So I'm just going to do just pop that there. Good. Okay. You can just perfect. Alright. So to begin with, I am just going to examine your body, okay? I am just going to have a little feel of your face, your head, your neck, your shoulders. I will come slightly lower down, check your arms, your legs, and your tummy. Do just let me know if you have any pain or discomfort, okay? Wonderful. So just like a little massage. Okay, I'm just going to check your face. Any pain or discomfort? Okay. Okay, now just your neck. And your shoulders. And your arm. I'm just going to give that bit of a massage. Do let me know if you have any pain or discomfort. Okay, the other side. Again, do let me know if you have any pain or discomfort. Okay. And I'm just going to check your legs, okay? I'm just going to do your thighs. Again, let me know if you've got any pain or discomfort. The other side. Lovely. Now I'm just going to put some pressure on your chest and your tummy. Just let me know if you get any pain or discomfort. Just pushing on your tummy now. Wonderful. Okay. Now just take a nice deep breath in for me. And out. Good. Take a nice deep breath in. Good. Take a nice deep breath in I'm now just going to check your breathing with my stethoscope. Okay, I'm just gonna pop this up. Okay, the other side. And lower it down. Good, and now back up here. Okay, take a nice deep breath in. Good. And take a nice deep breath in. Okay, take a nice deep breath in. Excellent. Your breathing's absolutely fine. You've got nothing to worry about there. Okay. Now, I'm going to check your eyes. Okay. So, I want you just to look here. And here. Look here. Look here. Look here. Very good. How many fingers am I holding up? How many? How many? Good. Very good. Okay, look here. Look here. Look. Look here. Okay. Tell me when you can see my fingers. Good. 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 Tell me when you can't see them, okay? Good. 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 Very good. Well done. Can you now look at my finger? And now follow my finger. Follow my finger. Follow my finger. Okay, can you follow this finger? Very good. You can just blink, blink, blink. Wonderful. I'm now going to use a light. I want you just to look at the light. 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 Good. Okay, now look over here. Do not look at the light. I'm just going to look into your eyes. Do not look at the light. And now this side, look at my hand, do not look at the light. Now can you look at the light? And now follow the light. Follow the light. Follow the light. Just keep following the light. Good, okay, blink, blink. Now look at this light, it's a bit brighter. Look at the light. 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 Okay, can you now follow this light? Is it a bit bright? No worries, just blink, blink, blink. You're doing so well. We're nearly done. Everything is looking wonderful. I'm not too concerned. But what I do want you to do, I want you to just do some exercises with me. So just lift your shoulders up and down, up and down. Very good. Can you just rotate your shoulders backwards like that? Good, and now forwards. Can you do that? Wonderful. Just move your head from side to the middle, to the side, to the middle, to the side. Good. And now can you just pop your head up and down, up and down. Wonderful. What I want you to do now is just get your hands and do this. That's it, you do it. I help you do that. That's it. Okay, now do a big smile and frown. Now wink, wink. Can you puff your cheeks? Good, and bring them in. Good, can you open your mouth wide and go, ah. Good, can you do this? Good, can you do this? Good, can you do this? Can you do this? This and this. Your thumbs. Okay, do that. Good, can you do this? Good, hold this for me. I'm going to push on you, okay? Good. Wonderful, well done. Okay, well, everything generally looks okay. I think regarding your symptoms, I think you need to have plenty of water. You do need to drink a little bit more. You need to have a good night's sleep. Yes. And just try and look after yourself, okay? But you're okay for now. But I'm gonna keep a good eye on you, so I would like you to come back soon, okay? Good, alright. Well, take care. Bye-bye.